I'd just done a trek of a month with my son in the Himalayas, and the right knee packed up. Went and saw a specialist I knew who did an arthroscopy on it, but in fact it made it much worse. I was then told that I needed a new knee, but I decided at that stage that I would try and overcome it with exercise and bracing and so on. And it was not until 2011 that it got really bad. I then decided to consult Paul Trikha, whom I'd got to know through treating some of his patients, and he'd treated some of mine, and discussed it with him, and he did a total knee replacement in November of 2011, which was very, very good, very effective. Helped, it was great. And then within a few weeks, the other one started to go, and although he did an arthroscopy on it, it didn't really help. And the following June, so it'll be 2 years ago next week, he replaced that one as well. And within a very short time, I was completely out of the pain I'd been in and feeling much better.
So the key motivator for you to have the first knee done would be pain, would you say?
Pain, definitely, yes.
And what about movement? How restricted were you in terms of...
Well, when it first started to get bad, I play golf regularly, and I thought I was going to have to give up golf, but I bought myself a little buggy which enabled me to play for 5 years. But eventually I got to the point where I just couldn't do anything on it. I really am not restricted at all. I still work, as I said, 25 hours a week, and I'm on my feet throughout that time. I think if there's anything that I really do have difficulty with, it's kneeling. I can kneel for short periods. I don't have to do too much with patients. But in general, I can do pretty much anything I want. I mean, I do a lot of do-it-yourself at home. I've been up on the roof of the garage, and I can do anything. But kneeling is the most difficult.
How much time did you spend on the physio side of things?
Well, in the beginning, I used to do an hour of exercise before I got out of bed in the morning. I'd set up my bedroom so I could do all the band work and quads work. I got it all organised so that when I woke in the morning, I worked for about an hour on it, and then I did quite a lot of hydrotherapy on it. And as soon as I could really walk any distance, I started going out for walks. If you want to get the best out of the surgery, you've got to do your exercise regimen.
You mentioned Mr. Paul Trikha was your consultant. How did you find your interaction with Paul in the Surrey Orthopaedic Clinic?
I got to know Paul after a series of lectures that he did up in Wimbledon, and I sent 2 or 3 patients to him, and they all did very well. And I rang him one day to talk about one of the patients and just said to him, I'd like to talk to you about my knee. And we got on very well right from the beginning, and I was very pleased to have him treat me. He also used a prosthesis which, on my own research, I felt was the right one for me. And so we got on very well right from the beginning. And he's been great. I could ring him at any time when I was a bit unhappy. So it was good.